This is Dr. Pierre Milot narrating my book, Rising from the Ashes of Loss, My Voyage Through Grief, available at Amazon.com. Post number 15, correction from number 14. The hours and days somehow passed by quickly, as the routine tests and exams were continually performed. From time to time, an important-looking doctor with pen in hand and carrying a bunch of medical files would come by for a visit to monitor Louise's progress. The usual feelings of insecurity and anxiety were at the party, but the professional and patient attitude of the nursing staff helped us to somehow cope better with the difficult circumstances. Aside from a few bumps and scary moments, the events were unfolding as they should, and Louise was making the expected hoped for progress. Her targeted release date from the hospital was rapidly approaching, and we could not wait to get out of that place. But there were a few hurdles to jump before we can get out of there, as we would learn soon. For instance, the importance of not removing her bladder shunt too soon, otherwise it would have to be reinserted a second time, as it was a painful procedure when done after the surgery. The other major source of concern, and this is no laughing matter, was the evacuation of gas and fecal matter. Anybody that's been there once knows what I'm talking about. This was a biggie for Louise, as she always been chronically constipated. The farting part was not a problem for her, or so she thought, and she was surprised to learn that the massive amount of medication ingested in the past weeks had blocked her pipes and had rendered her kind of silent and tight-ass, so to speak. "Never mind the hard stuff," she said to me. "That will come later. For now, let's get some wind passing." The solution to counter this problem, according to the nurses, was to walk endlessly in order to stimulate the peristaltic movement and get the bowels moving again. So, enriched with that knowledge, Louise, looking a little funny, dressed in the traditional hospital gown and hooked up to her mobile serum stand, proceeded to endlessly haunt the hospital corridors in the hope that the gas factory would soon open its doors again. As for me, like a faithful puppy, I accompanied her around and around the 8th floor of the hospital's convoluted passageways, smiling and discreetly waving here and there at the oncoming walking patients, wondering in amusement if they needed to fart too. While Louise was in a continuous struggle to keep her naked derriere from showing through the rear opening of the hospital gown, I, on the other hand, was on constant alert for any possible sound coming out of her butt cheeks. Nothing, not a bloody sound. And that, disheartening as it may have been, we bravely kept on the scenario. Eventually, one day, when returning to her room, completely exhausted and discouraged, she felt the urge to go. Wow. She had been in the bathroom for a few minutes, and I had just flopped into a chair when, all of a sudden, I heard a resounding and surprising loud noise behind the door. No explanation necessary, I guess. I understood what had happened, and when Louise poked her smiley mug through the open door, everyone in the room applauded because they all knew what was happening. What a great moment that was. The second phase of the evac operation went smoothly, and the hopes of escaping our bad dream just increased by a couple of notches. While waiting for Louise's release from the hospital, another scrumptious little moment worth mentioning occurred. Since her arrival at the hospital, Louise had been waiting to enjoy the private room she had been promised. But so far, zilch. The only ones available were double beds unit. After some time had passed, a nurse finally entered the room and announced proudly that a private room had just been freed up for Louise, and that she could move in immediately. Great news, I blurted. Furthermore, she told me that I could sleep beside Louise on a cot that she would bring in later on. So all excited, I rushed out of the hospital to gladly dispose of this depressing hotel room. Boy, little did I know then that the night to come would be nightmarish and full of surprises.